Hello and welcome to this video tutorial where I will be covering the innervation to the upper limb. If you haven't already watched the brachial plexus video, I suggest you do this first. I'll put a link to it in the description box below. Unless of course you're already super confident with that. In which case, let's just crack on. First, let's just take a brief look at the right arm in the anatomical position. This means slightly away from the body, with the hand supinated, therefore the palm is facing forward. The thumb is lateral and the pinky, the fifth digit, is medial. Let's just label up some of the muscles of the arm and the shoulder, as I'm going to be referring to these quite a lot throughout the course of this video. First, we have pectoralis major. This is innervated by the medial and the lateral pectoral nerves from the brachial plexus. Then we have the biceps, more specifically the short head of the biceps is labelled here. And we also have the clavicular part of the deltoid muscle. Okay, let's zoom in on the forearm. The first muscle we're going to look at is this lateral muscle, the brachioradialis. We also have the bicipital aponeurosis, pronator teres, the flexor carpi radialis, the palmaris longus, and the flexor carpi ulnaris. So what I'm going to do first is draw your attention to the posterior branch of the medial antebrachial cutaneous nerve. I'm going to start by getting rid of this because they clutter up the diagram a little bit and they will hide the nerves that we are actually looking for. I'm also going to get rid of this one, which is the medial antebrachial cutaneous nerve sitting on the anterior aspect of the bicep. Both of these nerves are minor branches of the brachial plexus, but today I want to focus on the major nerve. Okay, let's zoom back out so we can see the whole arm again. And we're going to get rid of pectoralis major and the biceps, so we can see the nerves underneath. Now if I zoom in on the coracobrachialis, we can see that a nerve runs anterior to this. This, I'm going to highlight purple, is the musculocutaneous nerve. And we can follow its course as it travels down the arm, giving off branches on the way. So here we have branches to the brachialis muscle and to the coracobrachialis muscle. I'm going to get rid of both of these now so they don't clutter up the diagram. Now as we continue to follow the course of the musculocutaneous nerve, we can see that more branches are given off to the brachialis muscle. Again, I'm going to delete this now. And as we continue it down, the musculocutaneous nerve becomes a sensory nerve at the cubital fossa, which innervates the lateral portion of the skin on the forearm. This is therefore called the lateral antebrachial cutaneous nerve. It continues down to the wrist onto the lateral aspect of the forearm, where it terminates. So that concludes the journey of the musculocutaneous. So I'm going to delete the lateral antebrachial cutaneous and the musculocutaneous. And we can now return back to our origin at the brachial plexus. Now what I'll do is return us back to the starting point so we can follow the whole course of the next nerve again. So in order to see the next nerve, I'm going to have to remove the coracobrachialis so we can have a closer look at the brachial plexus. I'm also going to remove the brachialis muscle as well. So as we zoom in, we can have a look at our next nerve, which is going to be the median nerve. I've highlighted it in purple here. We know that the median nerve is formed by the lateral and the medial cords, and as it travels down the arm, it moves medially to the brachialis muscle, which I have now removed. And as we can see from the diagram, the median nerve travels within the cubital fossa. So if I remove the bicipital aponeurosis and the pronator teres and the flexor carpi radialis muscle, we can see deep to it and determine where the median nerve travels. So I've highlighted the median nerve in purple again. and we can see that it travels anterior to the medial epicondyle of the humerus bone within the cubital fossa. I'm also now going to remove the brachioradialis and draw your attention to some deeper muscles of the anterior forearm, the flexor digitorum superficialis and the flexor digitorum profundus muscle. The median nerve travels deep to the flexor digitorum superficialis between the two heads of this muscle, but superficially to the flexor digitorum profundus muscle. Along the way, it gives off branches that innervate the flexor digitorum superficialis. Here's one in purple. I'm now going to remove this so we've seen it. I'm also now going to remove the flexor digitorum superficialis muscle so we can continue the median nerve's journey. Now within this compartment things get a little bit muddy, so let's bring the median nerve back up in purple. We can see along the way it's given off several other branches. These purple ones are branches to the deep surface of the flexor digitorum superficialis. I'll get rid of those. Whilst these ones in purple are for the superficial surface of the flexor digitorum profundus. Let's get rid of those as well. So now we're going to continue to follow that nerve down into the wrist. Here it is in purple. We can see at the end of this nerve, at the distal end, we have several other branches given off by the median nerve. This one highlighted in purple is the palm branch, which supplies sensation to the skin on the palm of the hand. Let's just remove that now. Next we have the common palmar digital branch, which then provide the nerves to the proper palmar digital branch. These nerves together provide skin sensation to the first 3.5 digits on the palmar aspect of the hand. I'll remove these nerves now so we don't confuse them at a later date. I'm also going to remove this branch here which innervates the muscles of the thenar. And I'm also going to remove these two nerves here which innervate the first two lumbricals of the hand. These are also branches of the median nerve. Now let's get rid of the distal part of the median nerve and travel back up to look for the last branch. This branch here is the anterior interosseous nerve of the forearm. It branches from the median nerve shortly after the cubital fossa. In order to get a better picture of this, I'm going to remove the flexor digitorum profundus muscle and the pronator quadratus muscle. If I just scroll distally, you should be able to see it a little bit better. There, gone. Okay. So I've highlighted the anterior interosseous nerve again, and if we look at the distal end, we can see that it provides some branches down here to the pronator quadratus muscle. Now I'm going to get rid of those, and I'm also going to remove the anterior interosseous nerve. And that concludes our journey of the median nerve. So if we shoot back to the anatomical position, we can zoom back in over here. Now we've got better access to this nerve, which is the medial brachial cutaneous nerve, again directly from the brachial plexus. So let's get rid of that so we can see. The next nerve we're going to look at is this nerve. This is the ulnar nerve. And this nerve comes from the medial cord of the brachial plexus. We can follow its descent down into the arm. If I turn the arm so we could get a more medial perspective, we can see that the ulnar nerve travels medially, but then posteriorly behind the medial epicondyle of the humerus, and between the two heads of the flexor carpi ulnaris muscle, and deep to that muscle also. I'm just going to remove that so we can see underneath. Now if I zoom in on the medial aspect of the elbow joint, we can see the ulnar nerve a bit more clearly. We can see that it gives off this branch here. This is the articular branch of the ulnar that supplies the elbow joint. And it also gives off these branches here, which innervate the flexor carpi ulnaris. let's get rid of those. So I've just zoomed out a little bit so we can see a bit more clearly. And there's the ulnar nerve again. So now what I'm going to do is I'm going to get rid of the bicipital aponeurosis and turn anteriorly to remove pronator teres and also the flexor carpi radialis and the palmaris longus and the flexor digitorum superficialis. So now we have a clear pathway of the ulnar nerve. We can see that the ulnar nerve gives a branch to the medial portion of the flexor digitorum profundus muscle. I'll just get rid of that now. And now we can continue distally down the arm to follow the tract of the ulnar nerve. I'll just rotate the arm slightly, just so you can see it from different perspectives. But as we follow the ulnar nerve down towards the hand, we can see that we get a few branches coming off. This branch is the palmar branch of the ulnar nerve that innervates the skin over the hypothenar eminences. I'll just get rid of that now. We also have this branch here, which is the dorsal branch of the ulnar nerve. If I rotate the hand around so we can see the dorsum aspect of the hand, we can see that the dorsum branch of the ulnar nerve gives rise to dorsal digital branches, highlighted here. These branches innervate the medial half of the back of the hand and the medial 2.5 fingers. So let's get rid of those now and move back to the palmar aspect of the hand, where we can see that the ulnar nerve travels deep to the palmaris brevis muscle. Let's just get rid of that. We can then see that the ulnar nerve gives rise to the superficial branch. Now this superficial branch also gives rise to smaller branches which supply the palmaris brevis muscle. In addition to this, we also have the common palmar digital branches and the proper palmar digital branches, which provide innervation to the skin of the little and half of the ring finger. I'll now just get rid of both of those to clear up the diagram. Now if I just zoom in and remove this muscle, the abductor digiti minimi, we can see the course of the ulnar nerve. Now we can see here we have the terminal branch of the ulnar nerve, which is the deep branch of the ulnar nerve. This courses deep through the hypothenar muscles and curves laterally to end at the adductor pollicis muscle. It also gives off branches to the interossei and the lumbricals of the hand. Now as we zoom back out, let us get rid of all of the ulnar nerves within the arm, as that concludes the journey of the ulnar nerve. So let's move on to the radial nerve. But for this nerve we have to have a look at the posterior aspect of the arm. So let's just move the model around and get ourselves familiar with the muscles on the back of the arm. So first of all we have the scapular part of the deltoid. We have the infraspinatus muscle. We have the teres major. We have the teres minor. And we have the triceps. This arrow in particular is pointing to the lateral head. We also have the long head of the triceps. The medial is currently hidden. So first of all I'm going to clear our view by removing the deltoid muscle. And I'm also going to remove the triceps. So whilst we zoom in, we're going to have a look at this muscle here. This is teres major, and we're going to remove that so we can see what is happening underneath. And now we're going to follow the course of this nerve, highlighted in purple. This nerve is the radial nerve, which gives off numerous branches as it courses down the arm. First of all, I want to have a look at this nerve here, which is the posterior brachial cutaneous nerve. This arises directly from the radial nerve. and supplies the skin on the back of the arm from the insertion of the deltoid to the olecranon. We also have this little nerve here, which is the nerve to the long head of the triceps. Let's get rid of both of those now. As we move down through the posterior arm, we can see that the radial nerve gives off more branches. This one supplies the medial head of the triceps brachii. Whilst this one is the inferior lateral brachial cutaneous nerve that supplies the skin on the lower half of the lateral side of the arm. Now we can also see that we have a long nerve here. This travels down the posterior aspect of the arm to the anconeus muscle, whilst this nerve innervates the skin of the lateral posterior forearm and is called the posterior antebrachial cutaneous nerve. Let's get rid of that one too. And now we can zoom back in on the course of the radial nerve. As the radial nerve courses down the arm towards the elbow, it gives rise to a small branch that supplies a small part of the brachialis muscle. Now let's just get rid of that and the anconeus muscle and the nerve to the anconeus to clear up our model a little bit better. Okay, so back to the radial nerve, and let's just reposition this model so we can get a better look at what is going on. Let's just remind ourselves of some of the muscles of the forearm. We have the brachioradialis, we have the extensor carpi radialis longus, and the brevis, extensor digitorum, and the extensor carpi ulnaris muscle. So I've just removed the brachioradialis, and now I'm going to remove the extensor carpi radialis longus muscle. I'm just rotating the model slightly more anteriorly so we can see. So the radial nerve divides into two further branches. The first one is this one. This is the superficial branch. As we track the course of this nerve down the lateral side of the arm, we can see it innervates the skin of the lateral side of the thumb. And additionally, we also have dorsal digital branches of the radial nerve, which supply the skin on the back of the hand. So let's remove those superficial branches now, and the superficial radial branch, and we will go back up to the cubital fossa and continue the other branch of the radial nerve. So let's zoom in and see what we have. Okay, first of all, we have the muscular branch to the brachioradialis. This comes off of the deep radial nerve. The deep radial nerve also provides a branch to the extensor carpi radialis longus. Let's get rid of that now. And let's get rid of the extensor carpi radialis brevis muscle so we can see underneath. And we can see under here that the deep radial nerve has also given us a branch to the extensor carpi radialis brevis. So to continue the course of the deep radial nerve, at first we're going to have to remove the extensor digitorum muscle and the supinator muscle. And we can see that the deep radial nerve travels deep to the supinator, near the proximal head of the radius, where it becomes the posterior interosseous nerve of the forearm, giving rise to branches that supply the supinator muscle. Now if we travel down the arm, we can see a branch to the extensor carpi ulnaris muscle. Let's get rid of that. And these branches here which supply the extensor digitorum. Again, we can get rid of those. To have a look where the posterior interosseous nerve then travels, we are first going to remove the abductor pollicis longus muscle and the extensor pollicis longus muscle too. And I'm just going to zoom out so we can orientate ourselves again. We can see the thumb on the lateral side. And zooming back in, we can see the nerves that supply the abductor pollicis longus, which I shall now remove again, and further branches which innervate the extensor pollicis longus, again which I will remove now, and the nerve to the extensor digiti minimi, and finally the extensor indicis nerve. And that terminates the interosseous nerve of the forearm. So before we move on, I just want to bring out a clinical implication of this. A common fracture site in adults is at the proximal head of the radius. This is often caused by falling on an outstretched hand with a hyperflexed elbow. And I'll just draw that fracture line in now so that we can see. The proximity of this fracture can have grave consequences for the deep radial nerve. As we've just discovered, the deep radial nerve is responsible for innervating the extensors of the forearm. When this nerve is damaged, it can produce a clinical symptom known as a wrist drop, where the wrist is unable to extend, and as are the fingers. This can be caused by damage by a displaced fracture, or severe swelling and bruising that occur around a fracture site. So let's move on to our final nerve that we're going to look at today. And so we have returned back to the anatomical position, where I will remove pectoralis major, the biceps, and the coracobrachialis. And now I'm just going to zoom out and rotate the model around for the posterior aspect. And we're going to remove the triceps, the deltoids, the infraspinatus muscle, and teres minor, and teres major muscle. Now I've just flipped the model back round to the anatomical position. So we're looking from the front, from the anterior position. And I'm going to highlight this nerve here. This is the axillary nerve. Like the radial nerve, this comes from the posterior cord of the brachial plexus. And as we follow the axillary nerve under the glenohumeral joint, we can see that it gives rise to branches that supply the deltoid muscle and the teres minor muscle. And finally, the superior lateral brachial cutaneous nerve, which is just disappearing off the right hand side of the screen. So that concludes this tutorial on the major nerves that branch from the brachial plexus that innervate the arm. Now I do have some summary slides to show you, and I will bring those up on the screen right now. So the first nerve we looked at was the musculocutaneous nerve. This comes from the lateral cord of the brachial plexus and receives fibres from C5, C6 and C7. Within the axilla, this innervates the coracobrachialis, and within the arm, this innervates the biceps brachii, a large part of the brachialis and the elbow joint. Whilst in the forearm, this musculocutaneous nerve then becomes a cutaneous nerve, and specifically it becomes the lateral cutaneous nerve of the forearm, supplying the skin on the lateral aspect of the forearm. The median nerve comes from the lateral and the medial cords. Within the axilla there are no branches, but within the arm we have a branch for the brachial artery. Within the forearm we have branches for the pronator teres, flexor carpi radialis, palmaris longus and the flexor digitorum superficialis. We also have the anterior interosseous nerve, which supplies flexor pollicis longus, flexor digitorum profundus, which is the lateral half, and the pronator quadratus and the wrist joint. Within the hand, these nerves supply the palmar cutaneous nerve, the three thenar muscles, lumbricals 1 and 2, and the palmar digital branches of the lateral 3.5 fingers. The ulnar comes from the medial cord, which takes fibres from C8 and T1. There are no branches within the axilla, but within the arm we have the branch for the elbow joint. Within the forearm we have the flexor carpi ulnaris. We have flexor digitorum profundus, that's the medial half. We have the ulnar artery, we have palmar cutaneous branch, and we have a branch for the wrist joint. We also have the posterior cutaneous branch, which supplies the skin of the medial dorsum of the hand and the 1.5 fingers. Within the hand, we also have branches to the palmaris brevis, the hypothenar muscles, adductor pollicis, lumbricals 3 and 4, the interossei, and cutaneous branches, the palmar digital branches to the medial 1.5 fingers. The radial nerve comes from the posterior cord. It takes fibres from C5 through to T1. Within the axilla, we have the posterior cutaneous nerve of the arm. We also have the nerve that supplies the anconeus muscle. Within the arm, it supplies the triceps, that's all 3 heads, a small part of the brachialis, the brachioradialis, the extensor carpi, and the elbow joint. We also have the posterior cutaneous nerve of the forearm. Within the forearm itself, we have the deep branch, which supplies via the posterior interosseous nerve, the extensor carpi radialis brevis, the supinator, extensor digitorum, extensor digiti minimi, extensor carpi ulnaris, abductor pollicis longus, extensor pollicis longus, extensor pollicis brevis, and extensor indicis, whilst the superficial branch provides the skin sensation to the lateral side dorsal aspect of the hand and the lateral 3.5 digits. And finally, we have the axillary nerve, which takes fibres from C5 and C6, the posterior cord. Within the axillary itself, it innervates the shoulder joint, that's the glenohumeral joint. Within the scapular region, we have the anterior branch, which provides skin sensation over the lower half of the deltoid and the deltoid muscle. We also have the posterior branch, which supplies teres minor, the deltoid, and the upper lateral cutaneous nerve of the arm to the skin over the lower half of the deltoid. I am Tanya. You have been listening to me from Anatomy and Beyond. I look forward to seeing you in the next tutorial. In the meantime, hit subscribe and give me a like. I'd love to see your comments in the box below. See you next time.